I'm Amy Thomas. It's the 4th of October 2013 and today I'll be demonstrating my airway management skills. First I'll be demonstrating the lateral side position, a triple airway manoeuvre, and then how to insert an oropharyngeal and a nasopharyngeal airway. Then I'll be demonstrating how to use a laryngoscope and lastly how to do assisted positive pressure ventilation using a bag valve mask. First I'm going to be demonstrating how to put the patient into the lateral position. So the first thing you want to do is check the patient's pockets to make sure that they're empty. And then I'm going to grab the patient's nearest arm to me and place it across the chest. And then the arms that's furthest away, making sure that it's placed out straight. Then I'm going to grab the leg that's nearest to me and bend it up. Then I'm going to place one hand at the hip and one hand at the shoulder and gently roll the patient over. I'm then going to grab the upper leg and place this at a 90-degree angle, while making sure that the arm that was placed across the patient's chest is pulled out away from the patient's head, making sure that the patient's head is extended so that any gravity can drain them out. A common error with this would be not removing the patient's arm away from the face, so blocking them out. Now I'm going to be demonstrating how to do the triple airway manoeuvre. On an adult, I want to place a 2 to 5 centimetre pad underneath the patient's head. On an infant, I'd place this underneath the shoulders, and on a paediatric, I wouldn't use anything at all. So the first thing we want to do is a chin lift, or place the patient into a sniffing position. So I'm going to place one hand on the patient's forehead with my thumb pointing towards the nose, and my other hand on the chin. I'm simply going to apply pressure to the forehead and lift the patient's head like so. The next thing you want to do is the jaw thrust. So I'm going to place my 5th, 4th and 3rd fingers underneath the patient's mandible, my index finger on the body of the mandible and my thumbs on the zygomatic process. I'm simply going to protract the jaw so I can see inside the airway. A common error with this would be not using a pad, so therefore the patient's head hyperextends and as you can see kinking the windpipe. I'm now going to be demonstrating how to insert an oropharyngeal into a patient. So you want the patient to be unconscious with no gag reflex, also they can't have trismus. So before you insert the OP, you need to measure it from the corner of the patient's mouth to the angle of the mandible. Once you have the correct size, you either lubricate with water or the patient's own saliva. I'm then going to insert the OP backwards, and then once I'm halfway, I'm going to rotate the OP 180 degrees while continuing to push down. You want the OP to sit flat onto the patient's lips. A common error with inserting OPs is either using one too big or too small. After you've inserted this, I'm then going to look, listen and feel for breathing. Now I've been demonstrating how to insert a nasopharyngeal. You want to do this on an unconscious patient that has trismus. So the first thing you want to do is measure the nasopharyngeal from the corner of the nose to the patient's earlobe. Once you have the right size, you want to lubricate with KY jelly. Then you want to check both nostrils to make sure there's no obstructions. Then you want to pick the largest nostril and insert the NP. Then you slowly want to push it in. If there's any resistance, making sure you pull it out straight away. You don't want to do this on a patient that has any middle facial fractures. A common error with this would be not pulling it out when there's any resistance and keep pushing. After you've inserted this, you would look, listen and feel again for breathing. Now I'll be demonstrating how to use a laryngoscope on the patient when you want to check the airway. So first you need the patient to be unconscious with no gag reflex present. So I'm going to place my right hand on the patient's forehead, and then I'm going to have the laryngoscope in my left hand. I'm going to put it in from the right side of the mouth, and then as I'm pushing down, moving the laryngoscope across to the left. You want the tip of the laryngoscope to sit into the valvular groove, and then going to pull up and forwards away from me, so then I can see the vocal cords. When I can see the vocal cords, this gives me a clear view of the whole patient's throat to make sure that there's no obstructions. Common error with this would be not getting the tip into the valvular groove and pushing forward further down into the patient's throat. Now I'm going to be demonstrating how to perform assisted positive pressure ventilation. So I would do this normally with an OPA already in the patient's mouth. So first I need to ensure that the face mask is the right size for the patient. So then I am able to ensure that I get a good seal around the patient's face to ensure that the oxygen doesn't get out. So then I'm going to squeeze this ventilation bag, ensuring that I'm not squeezing too hard so I over-ventilate the patient, which can be a common error. When doing this, I want to aim for 12 to 16 ventilations per minute. Ensuring that I'm seeing a rise and fall in the patient's chest and not in the stomach.